All right, so this is ultrasound. I just wanted to comment a little bit first on patient positioning. Before you even bring the cart in, let the patient know, okay, we're going to do an ultrasound and get them comfortable. We have Jesus here where he can sit comfortably at table side. In some cases, I might want him to lay down on his back so I can do some stretching along with that. But you want to take charge, tell them what position you want them in, make sure they're comfortable, and then start the modality or the procedure. Now with the ultrasound machine here, just have to remember a few things. It's plugged in already. You're going to turn that on. Now I want to cycle this down. Before I do anything, I'm going to cycle this down to a pulsating mode just so that the patient doesn't get any surprises. On pulsating mode, you could literally have this wand stationary and you can't do any damage. When it's on continuous, it could get a little warm and get uncomfortable. Usually it would get very uncomfortable before you did any damage, but you still don't want to make the person uncomfortable. We're going to set the timer here. Sometimes I'll overshoot that a little bit, but we're going to call that 8 minutes. Now the other thing is, once we turn this on, we don't just want it out there in open air vibrating, because it will run the crystal. We went through several of these machines because of that, or somebody dropping the sound heads, so we don't want to do that. So I'm going to go ahead, let's say we're going to do this on his extensor mechanism. You can see that it has contact. It's on pulsating, so I can turn it on. The intensity is all the way down. I'm going to go ahead now and start turning that intensity up. So there's nothing that you press to turn the sound head on. With this machine, you just start turning that up. And let's say that, and you can see that this is still on him, but it's not really moving because it's on pulsating. It doesn't have to be. You just got to make sure it's on pulsating. That's a 1:10 ratio. So I'm turning that up quite a bit. Now from here, I'm going to start moving it so that when I go over to the continuous mode, it's not stationary. Okay, so now we're at 2.3 watts per centimeter, which is kind of high, but I tend to do it a little bit on the higher side anyway. And as far as the distance that we're covering here, I'm going about 4 sound heads. So that's roughly 4 sound heads could fit in this area I'm working. If you have a bigger area, you don't work the entire area, you work the area of 4 sound heads at a time. Now, if this is turned up past your tolerance level, Jesus, you may feel a little achy sensation. You getting any achy sensation?
No.
If you do, make sure you let me know.
Okay.
Okay. Now the other thing that I like to do is use this sound head as a little bit of a Graston tool, because I don't have a whole lot of confidence in ultrasound anyway. So in this case, I'm going to go ahead and I'm going to push pretty hard here. And then at least I feel good about the fact that if the ultrasound isn't doing him much good, this pressure working through his tissues will create some mechanical effect and some scar tissue release there. But generally speaking, you're doing circles, you're moving this at the rate of about 2 to 3 sound heads per second. So 1, 2, 3, 1, 2, 3, 1, 2, 3, 2 to 3 sound heads. So this would be, too fast, and this would be probably too slow. I may have said 2 to 3 per minute, I meant 2 to 3 per second. But that is on the continuous mode. Again, if we were doing some pulsating, then we'd go over here to a 1 to 2 ratio, and I might just kind of set over here on that. I'm going to drag some gel over here, but I may just sit on that lateral epicondyle and just not move it very much. We might do that on the bicipital tendon to help with the calcifying tendonitis that a person's dealing with. But on pulsating, you really don't have to move this much at all. When it's on continuous, you do have to move it. And then, either the machine will beep and shut off on its own, but if you want to discontinue early, then you just turn this down. But you'll see I still have this on, and now I know it's safe because we have 0, and then I can take that off and do that. But if a patient complains about any discomfort, by all means turn down the machine. They should feel a little bit of warmth out of this after a few minutes of doing it, but that's really it. If they start feeling a deep achy sensation, it's penetrated to the bone surface. That periosteum of the bone is very sensitive, and they would get some achiness, and we would want to turn down the machine. Or if it's just uncomfortable for them, turn the machine off. And then afterwards, of course, I'm just going to take some of this gel off here. Afterwards, using ultrasound on this, using some alcohol on this would be a good idea. You'd rather clean it here in the room than, well, for one thing, it shows the patient that this was cleaned before it was brought in, and that's always a nice thing. And then it's just a good habit versus wheeling it outside and cleaning it outside. And notice, we get gel on this. This has a little bit of gel on it. Those are the type of things that would give us a bad Yelp review. Just know I'm particular about things being clean, right?